Office, Nigeria. And welcome to the first edition of the GET webinar series for the year 2025. Like we all know, this webinar series is organized by Global Emerging Pathogens Treatment Consortium, GET. And we're very happy to have you attend our webinar series again for the year 2025. I wish you a blessed, wonderful, healthy, and wealthy 2025. Say a big thank you to all our participants who were part of this webinar series in the year 2024, and to our speakers that have been working with us pro bono for years. You are the reason why we'll do this every month, and hopefully we'll pray that we'll be able to serve you better in the year 2025. My name is Dr. Oluwafemi Bobadoye, and I'm the Chief Operating Officer of Global Emerging Pathogens Treatment Consortium, GET. For those joining us for the first time, GET is Global Emerging Pathogens Treatment Consortium. As a non-governmental organization that was set up in 2014 at the peak of the Ebola crisis that ravaged a lot of countries in West Africa. It was clear during Ebola that West African countries lacked the capacity to cope with such level of biosecurity threats. And there was a need to set up both government and non-governmental organizations that will work with relevant stakeholders to build their capacity to cope with emerging biosecurity threats on the continent. And my organization, Global Emerging Pathogens Treatment Consortium, was one of the non-governmental organizations that was set up in 2014 by experts from different countries in Africa. And since 2014, we've been working with both government and non-governmental organizations to build capacity, provide information, and strengthen their ability to cope with emerging biosecurity threats. And this platform, the monthly webinar series, is one of the platforms we've been using in the last 4 years to build capacity to provide accurate, timely information from experts on relevant subject matter. And today, we'll be focusing on a very important, relevant subject matter, and we have 4 subject matter experts that will be discussing with us today. Today, we are focusing on HMPV, that's the Human Metapneumovirus. In recent months, that was in December and January, we see increase in cases of and hospital cases of this HMPV in some countries in the world, especially in Asia, in China, India, and a few other countries. And there was a big scale all over the world. I hope we're not having another global pandemic like we saw with COVID-19. But we thank God that HMPV is a seasonal disease, and we'll start seeing reduction in the cases in those countries. But we deem it very important for us to talk about this very important topic today, focusing on HMPV outbreaks, trying to understand the risks, strengthening preparedness, and advancing One Health in Africa to address the challenges. Today, we have 4 speakers that will be speaking to us, subject matter experts, and that means we'll be having 4 presentations, or let me say 4.5, because I'll also be making a very short presentation, reviewing the webinar, what we did last year, and our plan for this year for about 5 minutes. The objectives of the webinar today has to do with highlighting the significance of HMPV in Africa's public health landscape, and analyze the recent surge in HMPV cases in China and a few other countries, exploring potential implications for African nations and assessing Africa's vulnerability to respiratory virus outbreaks, drawing lessons from previous regional experiences. And finally, to explore effective strategies for strengthening preparedness, response, risk mitigation in Africa. And without wasting much time, I'll go straight to our first speaker. I'll introduce him for about 2 minutes and hand over the floor to him to give his presentation. Our first speaker today is Dr. Chizaram Onyia-Allah. I hope that pronunciation is correct. I'm sorry if it's not. Dr. Chizaram is a clinical scientist with over 10 years of progressive experience in internal medicine, infectious diseases, vaccinology, and global health. He is presently employed as a consultant physician an infectious disease specialist at the University of Port Harcourt Teaching Hospital in Nigeria, where he also served as a facility coordinator for the USCDC-funded HIV programs that cater for over 5,500 active clients, the largest HIV facility in Southside Nigeria. His research interest is in emerging infectious diseases, HIV medicine, outbreaks and pandemic preparedness and response. He has supported Lassa fever and other emerging infectious disease epidemic preparedness and outbreaks management in collaboration with relevant public health authorities. Dr. Onyegala has published over 30 peer-reviewed papers in reputable local and international journals, presented several scientific abstracts at national and international conferences, and serves as member of editorial board and reviewer, both local and international, including the Open Forum International Disease Therapeutic Advances for Infectious Diseases and Tropical Medicine, and many more. Is a member of several professional societies, including the International Society for Infectious Diseases, Infectious Disease Society for America, National AIDS Society and European Society for Clinical Microbiology and Infectious Diseases, to mention a few. Thank you very much, Dr. Chizaram, for joining us today. Please, you have the floor for about 20 minutes.
Thank you so much, Dr. Bovadoye. You tried to mention my name. And thank you, Gates, for having me. This is my first time of joining. And good morning, good afternoon, and good evening to all viewers from around the world. Permit me to share my slides, please. Okay, so today I'll be talking briefly on, are my slides being seen? Today I'll be talking briefly on human metapneumovirus, the causes, the symptoms, and preventive strategies, like I've been already introduced as a specialist at the University of Port Harcourt Teaching Hospital in Nigeria. Okay, so I'll be talking using this learning objective. By the end of this presentation, I hope participants will be able to answer these three questions. So, I mean, we're talking about human metapneumovirus. Is it a new disease? Is it a new virus? You know, there was a social media scare, just like the previous speakers said. We all work with what we're seeing on social, increasing hospitalization in India, in Malaysia, even in the United Kingdom. Actually, is not a new disease. It's decided by doctors who discovered human metapneumovirus 20 years ago among children who presented with acute lower respiratory tract illness. Furthermore, biological evidence also shows that virus has actually been in evidence for over, and they followed the analysis that was Dutch researchers again showed that virus actually jumped, you know, from the avian metapneumovirus very well in humans, that even the human metapneumovirus can no longer cause what we call reverse zoonosis. So let's talk briefly about the virology of this particular virus. Just like most respiratory viruses, it's an enveloped non-segmental single-stranded RNA virus belonging to the family of the Paramyxoviridae. It has a very similar relationship with the respiratory syncytial virus, and in the same Paramyxoviridae is where you have the measles virus and all. The key thing about it is that the genome of this virus contains 8 genes. And in those 8 genes, the F and the G genes are particularly important. It also contains 9 proteins, which we'll see shortly. So from those, the F and the G genes, that's why the strains are now sub-classified into 4 genotypes and 6 lineages. But not much has been done in the molecular epidemiology because this virus is not often being, you know, surveyed for. So we are not able to determine the relationship between each of the genotypes that have been found in all the continents in the world and severity. So we need to have more data to be able to do more work. So talking about the proteins, we have the 9 proteins. 6 are internal proteins and 3 are surface proteins. The small hydrophobic protein, the glycoprotein, and the fusion protein. The glycoprotein and the fusion protein are of particular importance in terms of research. That's where targeted research is going on to discover vaccines, to look at rapid diagnostic kits, to look at therapeutics. So much of the work is going on the G protein and the F protein, which are the surface proteins. The others play various roles in immune system evasion. So this is the typical structure of the virus. You can see the lipid bilayer, the matrix protein. These are all the 9 proteins that I've talked about briefly, but of particular importance for targeted research are the surface proteins, which you can easily see in the fusion protein and the glycoprotein. So by way of epidemiology is human metapneumovirus, is it a hidden, is it common, is this outbreak broke out? But it is actually a respiratory illness with worldwide distributed gender, and it has been reported infections. In 2006, to his brother or sister, the respiratory syncytial virus, as a commonly identified cause of pediatric lower respiratory tract infection. Recent estimates also done in 2018 alone showed that HMPV caused over 14 million infections in children under 5, leading to over 640,000 hospitalizations and over more than 7,000 deaths. Most of these deaths are in less than 6 months. And this is because the immunity in the HMPV is not lifelong. At 6 months, you have about 20% of people that have suffered from this infection before. Then about 5 to 10 years, you have about 90 to 100% of people that show seropositivity to IgG, to this virus. However, the immunoglobulins are not neutralizing. They are not neutralizing antibodies, and because of that, you may tend to have a reinfection. The transmission is almost similar with all the other respiratory pathogens, including COVID. Spreads primarily through respiratory droplets or aerosols during coughing or sneezing, and then also there is also direct or indirect contact with contaminated surfaces. So close contacts, such as schools or healthcare settings, make it very contagious in crowded settings, even prisons. So when you have the weather or the seasonal period, so this disease can spread, through children, that when they have it, they still come to schools, or when people are presenting with it to hospitals and the hospitals are overwhelmed, you don't have good health system, you don't have resilient health system, to cohort patients and all that. The incubation period is typically between 3 to 6 days. But some people also show that it can happen between 2 to 8 days after exposure. And the problem with containment of this virus is that at the period of the incubation period and at the early period, the disease is already symptomatic. It's already infectious. So transmissibility is already happening at that early period. And in those that are immunocompromised, viral shedding can happen up to 14 days. So what are the likely causes of the spread of the surge of the HMPV that we had late last year and early this year? So while the cause of the HMPV is not fully understood, but several factors are clear, several characteristics. Chief among them is the seasonality of the disease. It usually has an epidemic peak late winter and early spring, particularly in the temperate region. And that's why we're having it, late winter, early spring, and then now we are beginning to have downward trend. And then also the co-circulation all the other pathogens, because it's respiratory infection. Typically, we have the HMPV. So it's difficult to high surveillance, that have high diagnostics, that are able to do some investigations that other speakers will be talking about, that will help us to delineate that this is HMPV. Beyond that, you'll be making a syndromic diagnosis of acute respiratory tract infection or lower respiratory tract infection. Also, can the virus mutate? Oh yes, why not? It's a respiratory virus. It's an RNA virus, it can mutate. However, it's been shown that the mutation of the HMPV is slower compared to other ones like the influenza and even the SARS-CoV-2. Perhaps some of these characteristics, including the pre-existing immunity, is why it's currently not being adjudged to be a respiratory pathogen of pandemic potential. Other causes include the post-pandemic immune gap. Most of the research that was done during COVID-19 showed that due to the lockdown, due to the social distancing, the physical distancing, most respiratory pathogens were having low prevalence. I reviewed a paper on influenza that showed that influenza at the time during 2020-2021 was about 0.something%. So perhaps the post-pandemic immune gap could have also accounted for immunity to be lost
Hello, Dr. Chizaram. If you can hear me, I think your network is bad. He has gone off. We'll wait for Dr. Chizaram for 2 minutes and we'll ask him to put up his video. So at least maybe his network can be better. Then we'll share his presentation from the headquarters here. So please give us 2 minutes to allow Dr. Chizaram to come back and finish his presentation while we'll share his live. While we wait for him, we'll go straight to our next presenter, Dr. Mojcevic. She's going to give her presentation now, while when Dr. Chizaram is back, we'll give him time to continue after Dr. Moje's presentation. So I'm going to introduce Dr. Moje, read about for about 2 minutes, then hand over the floor to her to make her presentation. Dr. Mojcevic, I hope I pronounced it well, is a clinical lecturer in infectious diseases and medical virology. Our research interests focus on HIV, tuberculosis, other tropical infections, and emerging infectious diseases, including COVID-19. Since the beginning of the year 2020, during the COVID-19 pandemic, as well as working on the NHS front line of the response, Dr. Civic provided scientific advice to the Chief Medical Officer, Scotland, and advisory groups on recent scientific development on COVID-19. She has been co-opted to NAVTAG, that's New and Emerging Respiratory Virus Threats Advisory Group, as a member for COVID-19, advising and producing guidance document for UKSIG, that's Scientific Advisory Group for Emergencies. She also provided advice and consultancy to the World Health Organization on risk communication during COVID-19 pandemic. Dr. Civic is also coordinating the recruitment of hospitalized COVID-19 patients in Southeast Asia and South Africa, working closely with international Severe Acute Respiratory and Emerging Infectious Consortium, funded by the Wellcome Trust. Additionally, she is co-leading a household in patients with tuberculosis in Kampala, Uganda, with support from GCRF NIHR. She's part of CORI network, that's COVID-19 National Rapid Evidence Review Group, working towards providing rapid reviews for government and the WHO. Alongside our academic work, Dr. Sevik developed a strong interest in science communication. She's passionate about the value of integrating science communication into our efforts to disseminate research, which has the potential to enhance knowledge exchange among scientists and physicians and the broader public. Dr. Muji, infectious disease, medical virology, and science communicator, St. Andrews School of Medicine, Scotland. Thank you very much, Dr. Muji, for joining us this afternoon. And please, you have the floor.
Many thanks for the introduction. I wanted to... Can you see me?
Yes, we can see you.
Okay. So I'm going to briefly kind of go through the data available globally and also the UK. Let me share my screen. Okay. Can you see my screen?
Yes, we can.
Oh, something happened. Sorry. Something happened. Now, can you see?
Yes, we can see it now. Can you put it on slide?
Okay. So currently, in many countries in Northern Hemisphere, influenza-like illness or acute respiratory infection rates are increasing, especially since the mid-December. And this has been seen as about the baseline levels that's usual for seasonal trend. Especially influenza activity has been elevated in many countries, in Europe, Central America, Caribbean, Western Africa, Middle Africa, and many countries across Asia. In this figure, you can see this is like virus detection, including influenza and other viral infections up to January 7th. We're seeing a sharp increase in many influenza like illnesses. Recent HMPV outbreak is actually triggered from some reports from China, has been shared by the previous speaker. China CDC has reported an upward trend of common acute respiratory infections, including seasonal influenza, RSV, HMPV. And this was actually much higher than expected for this time of the year. And highest positivity has been seen among those less than 5 years of age. And they reported an increased hospital admission due to HMPV. And some of the Chinese authorities confirmed that the health system actually is not overwhelmed. Hospital utilization is currently lower than this time last year, and there have been no emergency declarations or responses triggered. But there is definitely an increase of HMPV positivity across China and many Northern Hemisphere countries. I want to share some data from UK influenza surveillance. As you can see in this data, Initially around June, July time, we've seen some increase in SARS-CoV-2 that continued since October time this year, but it's now decreasing. But we've now started seeing like increase in RSV, as you can see here, blue line, and rhinovirus, including influenza, which is increasing sharply. When we look at the HMPV outbreak, you can see a slight increase for all parainfluenza adenovirus HMPV, but there is a much higher increasing trend for HMPV, which is around the but the highest positivity rates are among those less than age of 5. The positivity rate is around 10% in the UK. So currently, while Chinese authorities have declared some increased trend, we're not necessarily seeing much higher positivity for this time of the year in the UK. And many European countries also reported similar trend. So I think I just want to summarize, because I just wanted to give an overview of what's happening, across the world. Overall, HMPV is actually, trending as per, expectations for this time of the year. As you know, HMPV, and is reported by the previous speaker, is actually experienced, by everybody. Like by the age of 5, most of us are exposed to HMPV at least twice. And I think we're seeing the same thing at the moment. I think the trends are not about the expectations for this time of the year. However, because of COVID pandemic, there's a possibility that we're more aware of the respiratory infections now, and the hospitals are more aware, clinicians are more aware, laboratories are able to detect respiratory viruses more. The other possibility is, of course, we're going to see how it's going to trend over the next 2-3 months. When we especially go into February, March time, we may see much more increase, because that's when we see increase in respiratory viruses and increase in hospital admissions due to acute respiratory illness. It may be due to, us, generally the population being more aware of respiratory infections, and maybe less exposure during COVID to other respiratory infections. So I think I'll stop here. It was a brief discussion, but I'm looking forward to the panel discussion.
Thank you very much, Dr. Umud, for that detailed explanation on the HMPV virus and the trend in different parts of the world. Like you talked about the trend in China. There was an increase in cases in China and a few other Asian countries in recent months, especially in December and January. And also the surveillance in UK showing HMPV generally common in this time of the year, and more common with children of below 5 years. Clearly, because of COVID, the world is more aware of respiratory related diseases now, and there are more platforms to dictate as fast as possible, faster than what we used to have before COVID. But we'll continue to monitor it, and hopefully it won't be something that will lead to any form of epidemic or pandemic in any part of the world. So thank you very much for that detailed presentation. And And I'm sure our participants will have one or two questions to ask. For those that have questions to ask, please go to the chat box or the question and answer section of the online platform and put in your questions there. And our speakers will be very willing to answer your questions after the presentations. So I think Dr. Chizaram is back. If your network is okay now, we can give you about 7 minutes to complete your presentation. I think you stopped in slide 9 or 10. You can just pick it up from slide 10 and you complete your presentation in about 7 minutes. Thank you. If possible, we can share your slide from our side.
Can you share from it? Yeah, I think it's better. Network is also.
It will be easier for you to manage your network. So Secretariat, please share a slide as soon as possible. So, Doc, you have the floor, please. You can continue.
Okay, can you move to the next slide, please? I'm done with this. Yeah.
Hey, Doc, can you continue, please? I think your system is still muted. I think Dr. Chilezam is still having some issues with his network. So I'll go straight to the next presenter, but before we go to the next presenter, I would like to make a 5-minute presentation to review GET's webinar series in the year 2024. We strongly believe that our participants and our speakers are the reason why we organize this every month. And it's important for us to give at least a review of what we've been doing in the last 4 years with the webinar series, and especially focusing on last year, the year 2024. The presentation should not be more than 5 minutes. I'm not going to take much of your time. I'll go straight to the presentation. Let me try and share it. So like I said, I'll be giving an overview of the GET webinar series focusing on last year, the year 2024. Yeah, like you all know, the webinar series is organized by Global Emerging Pathogens Treatment Consortium, one of the leading biosecurity-based organizations in the world today. And the webinar series was started we started it in 2021. That was at the peak of the Ebola, of the COVID-19 pandemics all over the world. During COVID, it was clear that there were a whole lot of misinformation and disinformation, and a whole lot of people were losing trust in the mainstream media. So we started the webinar then in 2021 as a platform to provide accurate information about COVID-19, especially in Africa, bringing together top experts, those that were actively involved in COVID response, and those that recovered from COVID survivors, for them to come and share their experience about COVID, and so that the people will have accurate, direct information about COVID-19, especially in Africa. Yeah, so sorry, we have some network issues too from here. Like I said, we started the webinar in 2021 as a platform to bring together COVID experts and COVID survivors to give first-class information about COVID. There's like, and we started in 2021, brought together some experts, Akian Bayomi, African CDC, myself, and some experts from different organizations in the world to start talking about COVID-related issues in 2021. Next slide. And focusing on last year we had 11 different webinars from January to December, and the only month we did not have any webinar last year was in November, which was our conference month. And this shows the different webinar topics in each of the months in the year 2024. Next slide. These are the topics from July to December in 2024. Next slide. The breakdown of the webinar series in the year 2024. And there are three things that is important. Number one, it shows clearly that in the year 2024 alone, we had about 5,000 participants attend the webinar from over 60 different countries and all the continents of the world. And we had webinar months where we have people 600, 500, and 400 people attend the webinar. Generally, the range of participants we usually have every month is between 300 to 600 participants attended the webinar in the year 2024. Next slide, please. And also that from this, we can see from the bar charts, see that all the continents of the world were represented in 2024, from Europe to Asia, especially Africa, North America, South America, and even the oceanic. Next slide. And we can see the map showing participants, conference participants from different parts of the world, from Africa, Asia, Europe, North America, South America, Oceanic, Europe, all the continents of the world, and over 70 different countries were represented or participated in the webinar last year. Next slide. And what are our key achievements last year? In 2024, we were able to increase global participants, having participants from about 70 different countries, having up to 5,000 participants attend the webinar. We're able to bring together topics, subjects, matter experts to discuss issues and relevant topics from January to December last year. And we were able to foster partnership with both national and international organizations, including WHO, West African Health Organization, and many other international organizations. And what is our plan for the year 2025? We have 3 specific goals to add to what we did in 2024 in this year, 2025. The first one is we're preparing a policy brief compendium. We're preparing policy briefs from our webinar series last year. For each of the months, we're preparing policy briefs, and we're putting it together, sharing it with stakeholders. Policy brief the compendium should be ready by next month, actually before the next webinar series. Strongly believe that this compendium will be a very good document for relevant stakeholders, from policymakers to government workers to researchers, lecturers, and even students. Could be a very good document for decision-making, for information, for research gathering, and many other activities for relevant stakeholders. We are also planning to start a short certified training program this year on relevant subject matters like infection prevention and control, biosecurity and biosafety management, One Health, just a short online 3 to 4 days capacity building program that will be certified this year. And we're planning a mid-year conference this year, focusing on biosecurity and artificial intelligence sometime in June, July. And this will be the pre-conference, which will be virtual, bringing together top experts to discuss issues around biosecurity and artificial intelligence. And this will dovetail in the main conference in November 2024 coming up in Lagos, Nigeria, which will be hybrid, both in person and virtual. Next slide. And we'll seek collaboration. We'll seek collaboration with both national, African, and international organizations, collaboration to continue to co-organize this webinar. Financial support. The webinar costs about $20,000 per year. That's about $1,800 per each webinar series. And GET is the one footing the bill of the webinar series for now, and we'll see collaboration in that area. We see collaboration to expand our reach. We're planning to have participants in over 100 countries this year, and we need a whole lot of advertisement, a whole lot of publicity to achieve that. And we also want to enhance our technical activities, bringing this webinar in different languages so that all our brothers and sisters that are not from English-speaking countries will be able to access this webinar, whether you speak French or you speak Spanish. And this is a breakdown of our expenses, of the webinar expenses per year. We spend so much money on Zoom subscription, email campaign, publicity. We'll give certificates out every month to all our participants, and as our participants increases, sending out certificates to 500, 600, 700 participants every month is becoming more tedious, and we have to bring in more expertise, more technicalities, and more staff to be involved in that. We spend money on internet and publicity material. So this is a breakdown of our budget. Salary of the project officer in charge is about $12,000 per year. Actually, the breakdown comes to about $1,800 per month and about $20,000 per year. Look forward to support of both national and international organizations to be part of what we're doing. We hope that this webinar series will grow far bigger this year and hopefully become one of the biggest platforms to discuss issues around health security, One Health and biosecurity on the continent and even in the world. Partnering with us will give you increased visibility, talking to a target audience of about 5,000 experts, and gives you opportunity to engage with relevant stakeholders to bring forth what you're doing, either as an organization or as an individual, and also the opportunity to advertise whatever you're doing, whether you're a company, you're an organization, you're an expert in a field, or you're a government organization. So we look forward to partnering with you in the year 2025. I will promise that we're going to make this webinar series bigger and better in the year 2025, bring together more language so that we can get our French-speaking brothers involved, our Spanish-speaking brothers involved, and make it a platform, one of the biggest platforms to discuss emerging issues in the area of health security and One Net on the continent. We say a big thank you to our participants that have been with us in the last 4 years, and they've built this webinar series with us. Thank you very much for your contribution. And to all our speakers that have been working with us pro bono in the last 4 years, we sincerely appreciate your efforts. And we say a big thank you to you too. Hopefully this year we'll make it bigger and we'll make it better. Thank you very much. So without wasting time, we'll go to the third speaker, and I'm going to introduce the third speaker, read his bio for about 2 minutes, and hand over the floor to him to give his presentation. Our third speaker today is Dr. Tafatua Zinamarira. I'm very sorry, Doc, if I did not pronounce that well. I'm going to read your bio and hand over the platform to you. Dr. Tafadazwa is a public health leader currently serving as ICAB's country director in Zambia. In his role, Dr. Tafadazwa is responsible for the strategic leadership and direction of ICAB's entire program of technical assistance, research, and training. Doc leads the conceptualization, planning, and leadership of several high-impact research and surveillance initiatives, including biobehavioral survey among key populations in the country, with expertise in the area of global health, infectious diseases, and public health laboratory systems strengthening. Dr. Tafadazwa has published his research in high-ranking scientific journals, including the Lancet Journal of Infection, that's British Infection Association, and Journal of the International AIDS Society. He serves on multiple expert and advisory groups, including the World Economic Forum Group Future Council on Antimicrobial Resistance, and International AIDS Society, the Industrial License Forum at IAS on HIV testing strategies to reach key populations. Doc has consulted for the World Health Organization on key research into antimicrobial resistance among bacterial etiology agents and bloodstream infections, BSI, in Africa. He is currently an advisor on research to study the evolving pathogenic spectrum of BSI and bacterial antibiotic resistance pattern in Rwanda Referral Hospital. Doc holds a PhD in public health medicine. Dr. Tafatua, thank you very much for joining us again today. And please, you have the floor.
Thank you. Thank you very much, moderator, for that introduction. I'll dive right into my presentation. So the purpose of my talk today is to share some insights on how we can strengthen Africa's preparedness and response to HMPV. For the first few slides, I think the first 3 slides or so, I delved into the virology as well as the epidemiology. So I'll just skip over those because I think the previous speakers have covered those extensively. So we'll start with the basics. What is it that we know? We know HMPV stands for Human Metapneumovirus. It's an RNA virus belonging to the Pneumoviridae family. And the infection that it causes is typically referred to as HMPV infection. It leads to respiratory illnesses that range from mild cold-like symptoms to more severe conditions such as pneumonia. And for asthmatic patients, we can see exacerbation in terms of symptoms. It primarily affects young children, elderly adults, and people with weakened immune systems. And we know that it is spread through respiratory droplets when an infected person coughs or sneezes. And it can also be transmitted via contaminated surfaces such as doorknobs and handles. And then one continues to touch their eyes or their nose and the mouth. So we know that about the virus. As mentioned by other speakers, HMPV is a seasonal virus that others refer to as a winter bug. So I guess the question that is on everyone's mind is it following that expected seasonal outbreak pattern, or should we be worried that there is something more serious? So I think from the start, I just wanted to be quick to say, with what we know so far, the answer to the question on everyone's mind, which is, could this be the next pandemic? With what we know so far is that this is extremely unlikely. And the reasons are multifaceted. But to mention a few, HMPV is not a new virus, as mentioned by the previous speakers. Like we saw with SARS-CoV-2, it's been circulating in its current form for decades. However, we will discuss some challenges in the next few slides. Like RSV, the respiratory syncytial virus, from which it's very difficult to distinguish between RSV and HMPV clinically. For RSV, we know there is a vaccine, but for HMPV, there is no vaccine against it. Patients usually recover after a few days of mild illness, and treatment usually constitutes of bed rest, fluids, and occasionally use of antivirals as well. As covered by the previous speakers, it primarily affects infants and elderly people, and the complications that I've spoke to as well. So to come to the current HMPV outbreak, I think the previous speaker has covered a bit about this, the December 2024 outbreak that was reported by the China Centers for Disease Prevention and Control. It became a cause for concern, and I think it sparked interest in public health professionals and ministries of health across the globe, because we're just recovering from a very deadly SARS-CoV-2 pandemic that really shocked the health systems around the world. So what's notable about this China outbreak is that it's the first major outbreak of HMPV that we have documented to this extent. And we've seen other countries coming as well to confirm cases. I've listed in the slide here some countries that have also confirmed a rise in cases, although very limited information exists on whether these outbreaks are related. This is also showing a bit more on the EPI. It was reported as among being part of the top 3 respiratory pathogens isolated from those age groups with those varying clinical presentations. So the challenges that relate to HMPV that I want to be quick to discuss here is that it is highly contagious. And as I mentioned earlier, there's a wide range of severity of illness, which is determined by a number of factors that have been discussed. We don't have an approved vaccine, and there isn't really specific therapeutics that are being used. The clinical presentation is non-specific, and therefore this can lead to misdiagnosis. It has a short incubation period of around 5 to 9 days, limited access to diagnosis, especially in low resource settings, including Africa. I think this has been alluded to before. And we also see that the virus replicates very slowly and inefficiently when we are looking at the microbiology. So what are some of the risks? I want to underscore this. The potential to spread is there. The potential for mutations is there. Scientists across the globe are worried about potential for mutations. There are vulnerable populations, which I mentioned earlier, that are at risk of very severe diseases. And then we're also worried that there could be non-adherence to infection prevention and control measures due to a phenomenon that is being termed COVID-19 fatigue. People no longer want to wash their hands frequently. People no longer want to wear face masks because they are fatigued from the intense measures that were put in to combat COVID-19. So what are some of the key messages from past respiratory outbreaks, and that's the focus of my talk today, that can speak to our preparedness and response? I think to sum it up, it's important that we recognize as a continent that preparedness is essential. Past respiratory outbreaks have shown us that being prepared is critical to managing any public health crisis that we may be faced with. And also key is the realization that health is a collective responsibility. So everyone has a role. All stakeholders have a role to play in ensuring health security. And what is more important in this world that we are living in is global cooperation. It's quite necessary to make sure that everyone is safe. There's a statement that public health experts usually refer to, that no one is safe until everyone is safe. So that's very critical to underscore as well. What is also important is to realize that there is need for agility in response. The response to outbreaks needs to be very flexible and adaptable due to the nature of these outbreaks that will be rapidly changing in terms of the requirements for how we respond to. Also important is the realization that unifying approach to preparedness is critical. I think systems that are there for preventing and preparing for, as well as responding to respiratory pathogens, needs to be unified. And this approach will address what we know already, as well as even novel pathogens that we may be faced with, and making sure that there's minimal duplication of efforts and there's very little fragmentation of efforts and resources. Another critical point to note is that there is need to integrate with broader plans. I think preparedness can be integrated into wider disaster risk management at national and regional levels, and making sure that these plans emphasize efficiency. So this slide just summarizes the preparedness and resilience for emerging threats, what is referred to as PRET initiative by the World Health Organization. And there are several components that you see there, starting with emergency coordination, the collaborative surveillance, community protection, clinical care, as well as access to countermeasures. And there are opportunities for strengthening preparedness that we have learned from past outbreaks that we can apply to our readiness for HMPV outbreaks in the region. So I'm not going to read all these out. I welcome questions and we can discuss after the talk. So what are some of the pillars? Again, going back to the basics, what are some of the pillars to public health emergency preparedness components, and how do they apply to HMPV outbreaks? So emergency coordination, which is having sub-pillars of policy and legal, legal and normative instruments, coordination, financing, HR is a critical component of any emergency preparedness response. I already covered collaborative surveillance. I think I've underscored this, making sure capacity for laboratories is ramped up, surveillance systems are there to detect and monitor, and also support evidence-informed operational decision-making. With regard to community protection, here we talk about things such as vaccination, chemoprophylaxis, risk communication and engagement, effective risk communication, which applies very much to HMPV, as well as making sure that we partner with communities to foster their engagement and ownership in any preparedness. So just as a reminder, for HMPV vaccine, we don't have an approved vaccine as yet. The fourth one, which relates to clinical care, deals with the health service provision, mapping of resources for respiratory pathogens, reviewing the systems that are there for ensuring and continually improving the quality of care and service delivery, dealing with evidence that we are finding on the ground, report from clinicians, reports from frontline health workers, and synthesizing those with what we know in literature to make sure that we are improving the quality of care, as well as making sure the efficiencies in service delivery. IPC cannot be underscored, cannot be overemphasized. It's very important as a component of clinical care. And then finally, access to countermeasures. This is very important, making sure that the overall national health emergency framework and systems are there to enable countries to be prepared and operationally ready for response to any public event. We have regional and continent-wide bodies that are supporting these processes and working closely with public health agencies or public health institutions in the different countries to make sure that our frameworks are available, they are updated, and they are well understood by the first responders as well as the larger community of health workers and other professionals. So this slide just speaks to a brief strengths, weaknesses, as well as opportunities and threats with regards to Africa's response to outbreaks. This is what we know, lessons that we've learned, and what we think, where we think we could be having potential opportunities for improvement. So just to pick a few, some of the strengths include a robust community health structure, which has been established, in efforts to combat a number of public health issues that we have to deal with, be it immunization, be it HIV, be it malaria, etc. So those community health structures are well established, and they are available to be leveraged in any response to outbreaks. There is skilled and resilient healthcare workforce. They are available. The adequacy is something else, but skill is available, and that serves as a strength to build on. With regards to weaknesses, the primary challenge that we face is limited resources that relate to our financial challenges that we face as African countries, and they are calls continent-wide for governments to work on increasing health budgets, to work on increasing their investment into their own populations' health needs. So these are things that we really always put out there when we make advocacy calls for public health and mention to policymakers that these are important considerations that we need to do. We have to finance the health system for us to have the infrastructure in place, for us to have the healthcare workforce in place, things that all are related to our ability to finance our own health systems. The weak health systems will then be characterized by inadequate data sharing. There are still some populations within the continent that have limited access to healthcare, so inequitable access to healthcare becomes another important weakness to take note of. However, there are opportunities that can be leveraged, that can be strengthened. I like the previous speaker's call for collaboration. Those are the opportunities that we have as Africa, the opportunities to collaborate and make sure that we strengthen our own health systems within the context of our continent. We are starting now to see investments in digital health. We are starting to see investments in research. We have well-established research centers and facilities across the continent that can be leveraged to inform how we respond to outbreaks. Some of the threats Obviously, the emerging and re-emerging infectious diseases, those remain an important threat. There's also the concept of climate change, which is a very important concept to think about when you think about health security, because of the intersection between climate change and health that I will not go into in this talk today. There's also AMR, a very important threat to our health systems, the emergence of resistance to common antimicrobials that we have relied on to treat infections for a number of years. So that stands up again as an important threat. In conclusion, I'll leave you with a quote from the WHO Health Emergencies Program Executive Director, Dr. Michael Ryan. He says, "We know that the future will bring other respiratory pathogen pandemics and large-scale health emergencies. As the world moves forward, a new way of approaching pandemic preparedness is called for." Very important and very powerful words. I'll end the talk with just showing here my references that I consulted, as well as acknowledging my colleague, Dr. Chalomba Chitanika, who reviewed these slides. Thank you for the opportunity. Over.
Thank you very much, Doctor, for that very detailed presentation on HMPV, the epidemiology, the outbreak in China, the challenges related to HMPV, the risk, and what we can do, the things we can do to reduce those risks that include, clinical care, access to measures to reduce the risk, importance of all stakeholders play their role in ensuring we reduce the risk, global cooperation, preparedness, and ending with that very good detailed short presentation showing the strengths, the weakness, the opportunities, and the threats that we have on the continent. So thank you very much, Doctor, for that very detailed presentation. And hopefully to our participants, we are going to share the presentations of our speakers with you after this webinar. That's if they give us a go ahead to share it. Hopefully they will give us a go ahead, and we're going to share the presentations with you immediately after this webinar, together with the certificates that goes with every webinar organized by GET. Without wasting much time, I'll go to our next presenter, the last but not the least, and it's Professor Omar Njaju, epidemiologist and public health expert, technical lead, DAI, tackling deadly diseases in Africa. Professor Omar Njaju is an epidemiologist and public health expert. He used to work at the Erasmus University, Rotterdam, Holland, and the University of California, the University of Minnesota, USA, and at the Université de Montpellier in Cameroon, where he headed the Public Health and Epidemiology unit. He heads projects in community health, One Health, global health, epidemiology, pandemic prevention, detection and response, public health system strengthening, health policies and strategies. Professor Omar was a senior technical advisor and Africa coordinator on the USAID One Health Workforce Project with the University of Minnesota, and later on country coordinator Cameroon for the tackling of deadly diseases in Africa, TDDAP, with Center Pasteur and DI Global Health. He was also the senior technical lead in charge of international health regulation and One Health in DAI Global Health. Since November 2022, he has been working on climate and health data using a One Health approach for early warning system and pragmatic decision making. Thank you very much, Professor Omar, for joining us today. And please, you have the floor. Prof, sorry if you can hear me, we can't hear you. I think maybe you are muted or something.
Can you hear me?
Fantastic, we can hear you clearly now.
Recorded.
Can you hear me?
Yes, Prof, we can hear you.
Can you hear me?
Yes, Prof, go on, please, we can hear you.
Okay, I will try to join from the other computer, and then you can share my presentation because on this one, so I'm trying to join on the other one. So thanks a lot for inviting me to this GET. It's my first time here, and it's a pleasure to listen to all these wonderful talks today. I would like to share my presentation. You can upload it, will be easier. Can you upload it on your side and share it, please, for the bandwidth we can have?
Yes, we're sharing it, Prof.
Thank you. Thank you very much. So today I wanted to talk about leveraging One Health to strengthen Africa's preparedness and mitigation strategy for outbreaks in general. So not only HMPV, because anything that would be good in terms of One Health for HMPV will be good for any outbreak. Next slide, please. So we are talking today about emerging infectious diseases, and as you know, it's one of our world's greatest challenge. Next text, please. Next slide. So when we speak about emerging infectious diseases, so we're talking about microbes and vector that have, gone through evolution even before us. And like Krauss said in 1998, he said microbes and vectors swim in the evolutionary stream, and they swim faster than we do. Bacteria reproduce every 30 minutes. For them, a millennium is compressed into a fortnight. They are a fleet on foot, and the pace of our research must keep up with them, or they will overtake us. So microbes were here on Earth 2 billion years before humans arrived. So learning every trick for survival, and it is likely that they will be here 2 billion years after we depart. That is Krauss in 1998. And it tells us a lot of the next slide, please. I can't see the next slide yet. So we are talking about, for infectious disease, about a world safe and secure from global threats that are posed by infectious diseases. So we have here talk about the global health security agenda, next slide, where we have a group of countries phased into 1 and 2, phase that are basically we are trying to prepare for the next pandemic. And so what are the drivers of those pandemic? The driver of pandemic risk, is basically emergence, human encroachment, exploitation, translocation, climate change, vector density and distribution, and some of the ecological pressure by men, which will lead to epidemic, and then that epidemic can be amplified by urbanization, population density, agriculture, and vector distribution. And then we move from epidemic from one spot to global spot, which is a pandemic. And then these will be helped by globalization, people travel, animal travel, vectors travel without visa. So that global trade also of animal and their product are, the drivers, for pandemic. Next slide. So what do we need then to address that is an integrated approach. What is the next slide, please? An integrated approach to One Health. So the One Health approach, we're talking about an approach that brings together various disciplines, medicine, veterinary science, public health, nursing, ecology, environment, and all other disciplines to work together to address more effectively emerging challenges that are the human-animal environment interface. And like we said, the emerging diseases, infectious, are the one of those most pressing of such challenges for human beings today, including the HMPV. Next slide, please. So, well, I can speak on the next slide. So we're trying here to leverage, next slide, we're trying here to leverage, a One Health approach, to actually address those challenges. And the One Health approach, as you see by definition, next slide, by definition from the One Health high-level expert panel, is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. And it recognizes, the health of human, domestic, and wild animal, plants, and the wider environment, including ecosystem, are closely linked and interdependent. So this approach, mobilizes multiple sectors, discipline, and communities at various levels of the society to work together to foster well-being and tackle threats to health and ecosystem while addressing the collective need for clean water, energy and air, safe and nutritious food, taking into action climate change, and contributing to sustainable development. That's a One Health high-level expert panel, definition in 2021. Can you hear me? I can't see the slide, but I can continue doing the talking.
Is it there now? Faith, can you see?
Okay, so the next slide, next two slides, please.
Next slide,
Next
presentation
slide,
mode.
next.
Good day.
The next one again. Okay, so which definition is much simpler that I like most better is that One Health is a collaborative effort of multiple disciplines working locally, nationally, and globally to attain optimal health for people, animals, and environment. So what we see is an interaction and a collaboration and a coordination between animals, humans, and environmental health, where we have disciplines like veterinary medicine, comparative medicine, human medicine, social science, and engineering, biology, ecology, working together, to address pressing challenges. Next slide, please. So why do we need One Health? Well, we need One Health because we want to prevent and respond to disease outbreaks. We want to reduce risk of infectious diseases and outbreak. We want to recognize and identify zoonosis. And we're thinking One Health, which is a unified approach, can be the solution. Next slide, please. Next slide. Next. Okay, next. So what are the strategies to reduce threats? So one of the most important things is to develop political will and funding, improve global early response capacity. And basically, we are talking here about, the Center for Disease Control, WHO, and training program. And other things to do will be to improve global surveillance, improve diagnostic capacity, basically training regulations, improve communication systems, one slide, next slide, we are on the side. So improve communication systems, and rapid data analysis, and develop, innovative surveillance and analysis strategies. Next slide, please. Next slide. So we want to improve global surveillance by using geographical information system, utilizing global positioning system, utilizing the global atlas of infectious disease, increase and improve laboratory capacity, coordinate human, animal, and animal environmental surveillance. So what are the One Health approaches that we want to suggest? Is number one, integrated early warning systems and integrated disease surveillance. Number two would be the laboratory systems into humans lab and environmental labs and animal labs. And the number three, One Health approach that we want to leverage on the One Health workforce, and the human resources for health. Next slide, please. So one other thing that is important now into One Health is the localization of One Health. So basically, we're thinking about those One Health approaches like risk communication and community engagement. We want to talk about the community training, for example, into AMR, into zoonosis, to let the community know what is a zoonose and how they happen, what is the transmission pathway. We can also think about the number three pillar on localizing One Health, which is effective decentralization, bringing all decisions that are usually taken at the national level to the district level, to a small, administrative unit. For instance, we can have effective decentralization of the multi-sectoral collaborative mechanism that we call the One Health platform that can be established at the regional or the district level. Another pillar is training of the, engagement of the community leaders and the civil societies. As we have recognized, civil societies can play a big part, in disease prevention, response, and outbreak response. And the fifth pillar is community-based surveillance. So we want the community to be, implicated in their own health by carrying out themselves their own surveillance. So we call all this, action, the localization of public health, and then we think about an approach, One Health approach, where several, disciplines, the community, the government work all together to implement all these 5 pillars. Next slide, please. So in terms of One Health approach for, early warning systems and disease surveillance, we are talking about community-based surveillance that are important, event-based surveillance that are very important too in, prevention, integrated disease surveillance, where we actually also work with all other disciplines, human, animal, environmental, surveillance systems that are now integrated, and they can have data exchange and analysis, for early warning. We are also now analyzing a lot of data, epidemiological data to create, early warning signal, early warning model that can be used, for programmatic decision making. So next slide, please. The second one about laboratory systems, we're talking about in the One Health having some environmental, labs, ecological lab, animal labs, human labs are already kind of very common. So we're thinking about putting them in networks. We have a network, laboratory network like ResoLab, putting those environmental lab, animal labs, and human labs into networks so that they can exchange information between sectors, and then we can rapidly track, diseases before they spill over. And one of the things that we see with COVID-19 now is the genomic surveillance. It's important to know that those HMPV virus mutate, and they mutate a lot, and they can become highly pathogenic. Like we say now, it's not a serious problem. It is a problem and not that serious. But the next mutation might bring it to a very strong virus, a very potent virus. So genomic surveillance is very important, and not only in human, but also in the animal side. So integrated genomic surveillance, ecological studies, and epidemiological modeling, within a One Health framework, provide crucial insight into the transmission pathway. Next slide, please. So the third approach is a One Health workforce. We're talking about we need to build a workforce that is adapted to the change. Next slide. So what is a One Health workforce? Next slide, please. One Health workforce. So we want to improve workforce capacity in countries to prevent, detect, and respond to threats that are posed by infectious diseases. So when we come together, various disciplines, a lot of people, particularly from the environment side, did not have that training into health security. They don't know a lot about, viruses and all this. So we need to bring them up to speed. So we're not trying to have pharmacists become a doctor or veterinarian become a biologist or ecologist, but we want them to work together, have the capacity at least to prevent, detect, and respond to threats. Next slide, please. And so, next slide. And so we want each One Health professional, to be well trained in their role, mandated, and appropriately equipped. So we need to have professionals that have improved skills to work collaboratively with each other. And next, we have health system benefit from One Health efficiencies. Next, please. So what is a One Health workforce? So I would say that it's important to work. It's a workforce that applies a multi-sectoral approach to infectious disease prevention, detection, and response. Basically, someone who is in that field will be having a technical competence. So you might be trained into biology, you might be trained into ecology, you might be trained as a doctor. But what is more important is the multi-sectoral skill, basically being able to foster multi-sectoral engagement, being able to work across silo, to work with other, to advance, the purpose of preventing, detecting, and response. And that a One Health workforce, requires supporting systems and what we call an enabling environment, legal, it can be legal, it can be anything that will be effective for multi-sectoral response. Next slide, please. And like we say, apart from the workforce, we need to have localization of One Health, localization of global health. And one thing I want to discuss with you, it tells you that the HMPV that we are talking today, when there's an outbreak, it happens in the community. It happens in a district. But all decisions are taken, at the national level. So what will happen is that long delay between, the moment you have the warning at the national level to respond to something in the community that usually is very far away. So we're trying to have, our system now using a One Health approach to localize global health, because we know the outbreaks usually occurs in the community and are now treated in the city capital, for instance. So we need to then have a lot of things in place. Next slide. Next slide, like community education and training, like I was saying. So if we have community that are trained, if we have community that are educated into zoonosis, then they are able to start responding, they are able to start detecting, they are able to start preparing well before. And so that's why it is important that we have a community that are well trained into zoonosis, into AMR, into HMPV. Next slide, please. What is also important into all this one, next slide, is that we need to have strong communities. We need to have resilient community, and to build those resilient communities, we need to have local institutions. No, previous one, you want one file. So we need to have local institutions and community that are strengthened. And so that strengthening is important so that they can be able to have their own, decision made at their local level. So we think that by institutionalizing a One Health approach and training those community, we can have strong institution and community that are able to act on their own behalf, that are able to start the response system so that there's no spillover, that they are able to detect the disease in animals before they spread to humans. Next slide, please. So, next slide. So one of those things that we do then is, wow. We are too far, to slide back. So one of those things that we try to do then is multi-sectoral engagement. So where we do community training, community outreach, and community engagement. For instance, we can have a rabies outreach campaign. We can have where we educate the community on rabies awareness, as well as hygiene and sanitation. We can administer like vaccination at those occasions. So those community outreach, those community training, those community engagement, where it includes risk communication and addressing infodemia, for instance, are very important, to have resilient community and community that can act on their own behalf. Next slide, please. So those strengthening of the community is one of the centerpiece for localizing global health. So we need to have civil society that are strengthened, like I say. We need to decentralize the response at the community level, have local One Health platforms. We have seen that those communities that have local One Health platforms are very, are better far performing than those who have done, because they can decide at the local level, how to better prevent this, detect and respond to outbreak. And then that's also a way to coordinate, the community-based surveillance. That's a very costly system. It's a very efficient system, but then that's a best way that already we have localized global health security. Next slide, please. So, next slide. So finally, I would say, just to conclude, and that, embracing a One Health approach is a proactive, as a proactive sentinel system for surveillance, means a transformative shift from reactive to proactive public health. So we need to focus on early detection of zoonotic threat. We can implement preventive measures that safeguard human and animal health, ultimately reducing the risk of pandemic outbreak. So investing in the One Health strategy is not just prudent measure, but it's a hopeful step forward, a safer, more resilient future against the looming threats of emerging infectious diseases. So thank you for listening. Thanks.
Thank you very much, Paul, for that very detailed presentation on One Health. The presentation was detailed, although I had issues with my connection and I was not able to participate for about a few minutes. The few slides I listened to, the presentation was very detailed on One Health. Thank you very much. You spoke clearly on One Health as an integrated solution to addressing emerging health issues in Africa, especially in the area of emerging infectious diseases, understanding the concept of One Health and understanding the link between human, animal, and environmental health as a solution to addressing emerging issues in Africa, and knowing clearly that most of our emerging infectious diseases are zoonotic. That means they are from animal origin. And for us to effectively address it, we have to take the health of animals and the environment they live in very serious. And that shows clearly that One Health is an integrated solution to addressing most of the emerging infectious diseases and other health challenges we have in Africa today. And you talked about the various strategies, coordination and cooperation in the laboratories, coordination and cooperation with surveillance, animal surveillance, environmental surveillance, and human surveillance workforce coming together, integrating different sources of knowledge to address emerging health challenges facing us in the world today, especially in Africa. Talked about the need to get the civil societies involved, the need to domesticate the One Health approach, the improve community systems, and get all stakeholders involved in addressing the emerging health challenges we have in our world today. Thank you very much, Prof. And like I said to our presenters, we're going to be sharing the presentations. Our participants, rather, we're going to be sharing the presentations after this webinar series. And we're coming close to the end of the webinar series, and I can see some questions. Well, most of the questions have been answered by the speakers. Before we go, we're going to do one thing. We're going to give opportunity to two participants to contribute. If you want to contribute as a participant, just signify by raising your hand. And we're going to unmute you and give you the opportunity to contribute for about 1 or 2 minutes. So if any of our participants is interested in contributing to the discussion of today, please just signify by raising your hand, and we are going to unmute you from this side, from the secretariat. So if there are no hands up, we are going to read few questions online. I'm just going to read some of the questions and give opportunity to our speakers to respond. There is one question here from Bernadette von der Hogen. I hope I pronounced it well. I don't agree with this statement that mutations can lead to more severe viruses. The virus have shown evolution over the last 70 years, but mutations have never led to more severe diseases. So it is highly unlikely that this would happen. That's one of our questions. Can I call on the speakers to answer? Dr. Muji, can you speak to that?
Can you hear me now?
Yes, we can. Please
Hello.
go on.
So I don't know whether this comment is specific about HMPV, but yes, I mean, I think specifically for HMPV, because we know this virus for a long time, and it's been, in evolution for, as you say, over more than 50 years. But same thing happened with monkeypox, right? So we knew that virus for some time, and it's been circulating for a long time. But we've seen evolution, and it led to increased severity of infection, increased transmission rates. So I think it's a bit, although it's very different than monkeypox and COVID, HMPV also needs to be monitored. So I think it's a bit difficult to be certain at this moment. I think it is, I think, unlikely, I would say. But in a virology world, it's a bit difficult to say it unless you monitor for a long time. I hope the other speakers agree with me too. Thank you.
Thank you, Dr. Muji. Can we have contributions from other speakers, please?
Okay, I think I agree with Dr. Muji. Yes, with our experience from COVID and monkeypox or mpox, and we've seen that mutations happen and it can lead to severity and increased transmissibility of the virus. You know, and monkeypox is a DNA virus. When you are looking at it, maybe it looks as if it's unlikely for that type of mutation, you know, to happen. But it's not quite the same with the HMPV. But again, just like Dr. Muji said, there's not much very good data for HMPV. So I think what we can do, while it's unlikely, is to begin to accumulate data, you know, from the countries, you know, high-income countries, even in Africa, although we don't have very robust protection, and begin to see this virus and see a bit of more data collection. If it looks likely, since we've had it around, but then also we've had it around this, and there was. Thank you.
Thank you very much, Doc. There's another question here which I want us to respond to. Now, I think, Prof, these questions directed to Prof. It says, what are the main challenges in applying the One Health framework for HMPV prevention and control in Africa? And how can we overcome these challenges? Prof, please, can you respond to the question?
Yes, thank you, and thanks for the question. So I do believe there are several challenges to apply the One Health framework for HMPV. The big problem, I would say, is communication that I see. There's already a lot of infodemia on HMPV. So recognizing that is an important pathology, recognizing that it can mutate or can be very serious next is an important thing. Other sectors, for instance, environmental sector, they don't know or they don't even think it's a serious problem. Many people don't even know HMPV can find themselves in waste. They can find themselves in any other surface, environmental. So the environmental people don't even know. So working across sector, working together will be very difficult. You see, it took a lot of time for people to start also realizing that the COVID-19, which was very serious, was affecting economy. So economists were not even concerned at the moment. So the main thing is the knowledge, is the communication. We need to communicate a lot on that. So when we want to apply the One Health framework into that, the main problem then is people are still working in their silo, and then people are not even working. Some silos, some sectors are not even working on HMPV. So one of the things also applying the One Health framework is the surveillance, setting surveillance for HMPV, where who is going to do that. So we always wait until it is too late, you know, to start doing our response to. So we want to move from reactive, system to a proactive system, and that is one of the big challenges in applying the One Health framework for HMPV. We're still waiting that it creates a lot of havoc before we start doing something. So what can we do? We need to communicate effectively. We need to, like what we're doing in this webinar, we need to make sure that people know what it is, other sectors know what it is. We need to have platforms, like One Health platform in each country, start spreading the message. we need to have that multi-sectoral coordination and collaboration mechanism in place for that to start happening. So that can be, a solution to address those challenges. Thank you.
Thank you, Prof. There is another question that is related to that. And it says, what are the main challenges in applying? Okay. It says, how can a cross-sector collaboration between human, animal, and environmental health professionals enhance biorisk management strategies for respiratory virus outbreaks? Sorry, Prof, did you get that? It says, how can cross-sectoral collaboration between human, animal, and environmental health professionals enhance biorisk management strategies for respiratory virus outbreaks? Prof,
You are
please, can
breaking.
you respond to that?
I'm trying to get the question correct. So I didn't get the second part of the question. I'm sorry.
Then
I didn't get the second part of it.
Saying how can we use the One Health approach, that is human, animal, and environmental health professionals, how can they enhance biorisk management strategies for respiratory virus outbreaks? And how can we use the One Health approach to manage respiratory virus outbreaks?
Okay, so we already learned a lot from SARS-CoV-19, and in terms of how to manage, like respiratory diseases, we need to just recognize that every virus is different, that this can change rapidly. We need to do research. Research is very important here. That's what I think, that laboratories are very important here. I believe that the first thing to set up already is having the HMPV, sequence completely. We need to know the genomic sequence. And from that moment, we need to start doing what we call predict, building capacity to know all forms that can be mutated and which form might be able to spill over and to create a lot of problems. So my first thing is, again, integrated genomic surveillance will be very important to there. And then how do we do the biorisk? Biorisk, biosafety, biosecurity there in the lab for HMPV there is going to be the same that we did for all viral diseases. We need to take them as potential threats. I don't want to take long, but I'll be happy to continue discussing with the participants and everyone on that. Thank you.
Oh, fantastic. Thank you very much, Prof. Do you have last contribution from our remaining speakers, Dr. Muji, Dr. Chiazam, I hope pronunciation is right, and my other doctor. Last words, please, before we round up today's webinar.
Okay, maybe I talk first. For me, coming from Africa, I think this is an opportunity for us to begin to improve our surveillance for respiratory multipathogens. So in my country, in Nigeria, what we have is only influenza sentinels surveillance. And beyond that, we are not looking at respiratory syncytial virus, HMPV, rhinovirus, and even our COVID surveillance is almost very suboptimal now. So respiratory pathogens are still of interest, and it's important for Africa, to build health systems, response, preparedness, get ready. We don't know coming. So this is an opportunity for us, to begin to talk to key stakeholders, ministries of health, national public health institutes, state ministries of health, and other resilient health systems for Africa.
Thank you very much, Dr. Chizara. Professor or Dr. Muji, can you give us your last word about 1 minute?
Hi, thank you so much for the invite, and it was great to learn from other speakers as well. And I think there are also very knowledgeable people in the attendees too. If they could also contribute, that would be great. And I think my last words is I think overall what we're seeing, especially since COVID, is like there's probably increased recognition of re-emerging infections, right? I'm not saying that HMPV will, become a worldwide, problematic virus, but I think this is an important lesson for us to be able to monitor these viruses, especially in the African context, because although I'm giving an example about Mpox, I think that's important for Africa, because I'm doing some surveillance work and seroprevalence work in Uganda, Kenya, Rwanda. What we're seeing is much more higher prevalence than what was previously known. So I think this kind of shows the need for continued monitoring, continued efforts, continued funds to be able to be directed to the African continent too. And there are also great institutions in countries that I'm working in, Uganda and Kenya, as far as I know, we are able to monitor some mutations we're talking about, I think we need to be much more aware, resilient, and open-minded. I think the fact that we know this virus hasn't evolved over the last 70 years doesn't mean that it's not going to evolve. I think the only way to know this is to be able to monitor it. And again, like similarly for other respiratory infections too, we need to have much more cooperation, collaboration to continue some of the efforts we started during COVID. This is my personal opinion, but thank you so much.
Thank you so much, Dr. Muji, for that last contribution. Prof, please, you have the floor for about 2 minutes.
Thanks a lot, and thanks to Get for that opportunity, that webinar. That was really interesting. I want to say that I also myself learned a lot from the other speakers. It was very, insightful into HMPV. I must say that these are the kind of things that are important for us to be able to start thinking about that. I don't know about any structure or institution that is actually even actively testing, for HMPV. And that is this kind of situation that we need to start telling people that there's a new virus out there. It might not be terribly pathogenic at this time, but it might evolve, like the previous speaker said. So we need to start thinking about a proactive, system than a reactive system. Even though we know HMPV is there, we're still waiting to be, reactive to when it's going to be worse, when it's going to mutate. So, and part of that being proactive is early warning system. We need to talk about how do we start detecting pathogens, not only before the spillover, even the spillover, we need to have our decision process. We need to have even our response system, knowing that the community will be very important in that. And I'm not sure that communities like several places that I've traveled to are even aware that there's another HMPV that has been there for many years, you know, and that there's a re-emergence. So I believe that this webinar needs to be publicized. I believe that the One Health approach needs to be made familiar. I would believe that we need to start localizing global health. And what I want to think is that we need to publish a lot of those material that we have out there. We need to, like some people will say now, we need to make noise on the social media to have things, you know, happen, not only for HMPV, but several of the viruses that are out there and just waiting to jump. Thank you.
Thank you very much, Prof. And with that statement, we've come to the end of the first webinar series of the first webinar of the GET webinar series for the year 2025. And I want to say a big thank you to all our speakers for sharing from their wealth of knowledge today. Thank you very much. I also want to say a very big thank you to our participants. We've had over 200 participants in the last 1.5 hours thereabouts, listening to us and learning from the wealth of knowledge our experts have. Thank you very much. We sincerely appreciate this. And from Global Emerging Pathogens Treatment Consortium, one of our aim is to create platforms to disseminate relevant information in the area of One Health and health security. And we have several platforms that we use for that. One of them is this webinar that is ongoing. The other platforms we have is our GET journal. GET presently runs the first biosecurity and One Health journal in Africa. It's absolutely free for Africans, where you can publish your relevant manuscripts in the area of health security, One Health, and biosecurity. It's called GET Journal of One Health and Biosecurity. You can check that out on our website, www.getjournal.org. We'll publish our monthly technical paper, and we also publish quarterly newsletter. All this platform is meant to provide relevant information in the area of One Health and biosecurity. And we also organize the annual conference, the GET annual conference on One Health and biosecurity. It has been organized in different cities in Africa, in Lagos, in Abuja, in Accra, Ghana, in Sierra Leone, in Senegal. And this year, the conference usually comes up in November. This year, we'll be focusing on biosecurity and artificial intelligence, and the conference will be coming out from 6th to 8th of November 2025 in Lagos, Nigeria. Watch out for that. And before we end, we'll look forward to collaborations with relevant stakeholders, universities, international organizations, national organizations. Like I used to say, biosecurity is everybody's business. And like Prof said, we'll need integration of different stakeholders for us to effectively address emerging challenges that is facing our health systems, especially in Africa today. So thank you very much to our speakers and our participants. Look towards having you again next month. This time next month, by God's grace, we're going to be having another series of the GET webinar series. And until that, on behalf of members of staffs of the Global Emerging Pathogens Treatment Consortium, we'll say thank you, and we'll say bye-bye from the Secretariat. Thank you, and have a blessed rest of the day. Bye.
Thank you. Bye.